Hello everyone, welcome to my channel. I am Dr. Sauravi. When we are studying Shalakya tantra, we will learn about diseases of various Urdhvajatrugata. But before diving into these diseases, we must learn about their anatomy. So today we are starting with anatomy of ear. Ear is divided into three parts, that is the external ear, the middle ear and the internal ear. In this video, we will deal with anatomy of external ear. External ear consists of the auricle, or very commonly known as the pinna, the EAC and the tympanic membrane. So let's start with pinna. Pinna or auricle is a cartilaginous structure. Now touch your pinna. Is it flexible? Can you move it very easily? Can you fold it very easily? Yes, you can. So what kind of cartilage it would be made up of? You're correct. It is made up of yellow elastic cartilage. Above your pinna, you have a structure that known as perichondrium. Now, perichondrium has a clinical significance. Inflammation of perichondrium leads to a condition called perichondritis. And perichondritis is associated with a sign called tenderness of your pinna. Tenderness of pinna. Now, above perichondrium, we have our skin. So, we can say that perichondrium acts as a barrier between your skin and cartilage. Correct. Now, look at the diagram. Can you see various elevations and depressions of your pinna? The first elevation we have is our helix. Then we have our antihelix in the opposite direction. Then we have our tragus, and opposite to tragus we have our antitragus. Then we have few depressions. The first one just below our helix is the triangular fossa. Below that we have our Simba concha, and below that we have our concha. Now concha forms the opening to our EAC. Now there are two areas that are devoid of cartilage. These areas are very important clinically. Areas devoid of cartilage. The first area you must know, you would have learned in your anatomy classes. Right, it is the lobule. And the second area is the incisura terminalis. Where is your incisura terminalis located? Can you identify, guys? Where is your incisura terminalis located? Look at this diagram. Can you find the crus of helix here? And here we have our tragus. So the area between this crus of helix and tragus is called as incisura terminalis. What it is called? Incisura terminalis. Now, incisura terminalis is an area which is devoid of cartilage, right? So, whenever we make an incision here, the complications, the chances of complications or any infections or inflammations will be very minimum. So, it acts as an excellent site for incision in our endoral surgeries. Endoral surgeries. While lobule is made up of fat. So, lobule acts as a site for fat grafts. That's all for our auricle and pinna. Let's do a quick revision of the pinna. It is a cartilaginous structure made up of yellow elastic cartilage. Below it we have perichondrium, and the area devoid of cartilage is the incisura terminalis and lobule. Incisura terminalis forms the site for incision in endoral surgeries, and the lobule forms the site for fat grafts. Now let's look at EAC. The EAC is also known as the external acoustic canal or external auditory canal. Now it extends from concha to your tympanic membrane. It is 24 mm long. It is not a straight tube, but it is an S-shaped tube. That means its outer part is directed upwards, backwards, and medially, while its inner part is directed downwards, forwards, and medially. Now, during the examination of ear, it will be difficult to visualize the complete EAC. Thus, a maneuver is used to straighten the patient's EAC. This maneuver in the adults is in the direction upward, outward, and backwards. And in children, this is downwards and backwards. This maneuver is a very important question in Viva and is very often asked. So do remember this. Now our EAC has two parts. Let's look at a small diagram for our EAC. Our EAC is divided into two parts. So let's make a small diagram to learn about it. This is our pinna. This is our EAC. And this is our tympanic membrane. Now EAC has two parts. The outer one-third part is the cartilaginous part. And the inner two-third part is the bony part. In your cartilaginous part, it has ceraminous and sebaceous glands, while it also has hair follicles here. In bony part, the glands and hair follicles both are absent. These glands produce wax in the EAC, and the hair follicles also have a clinical significance. When there is inflammation of these hair follicles, it leads to a condition called furunculosis. Now, when there is furunculosis of anterior wall of the EAC, it will lead to a sign called Tragus sign. Do remember, it is very important in your practical exams. Now, as you can understand that hair follicles are absent in your bony canal, so furunculosis is also restricted only in your cartilaginous canal. Now, below your EAC, you have a gland, a salivary gland. Can you guess what gland it would be? Right. It is the parotid gland. Our EAC has two communications with the parotid gland. This allows infections to travel from the parotid gland to EAC and from EAC to parotid gland. So, one communication is located in cartilaginous part, which is known as the fissure of Santorini. And the another communication is known as the foramen of Hashke. Foramen of Hashke. Now these communications obliterate by the age of 5 to 7 years. We have another important structure in our bony canal. Can you look at this diagram? Can you identify where the tympanic membrane is? Correct. It's here. This is our tympanic membrane. So 6 mm lateral to our tympanic membrane, we have the narrowest region. We have the narrowest region in our canal. And this narrowest region is called as the isthmus. In this region, the foreign body gets lodged and is very difficult to remove. So let's do a quick recap of what we learned till now. The EAC extends from the concha to the tympanic membrane. It's 24 mm long and it's not a straight tube, right? The outer part is directed upwards, backwards and medially. The inner part is directed downwards, forwards and medially. It has two parts, cartilaginous and bony. The cartilaginous part forms the outer 1/3. Now since the whole EAC is 24 mm long, its 1/3 will be 8 mm long and its 2/3 will be 16 mm long. So 8 mm long is our cartilaginous canal and the 16 mm is our bony canal. Now the cartilage is continuation of the cartilage which forms the framework of the pinna. It has a deficiency known as the fissure of Santorini. Through them the parotid infections can appear in the canal or vice versa. It contains raminas and pilosebaceous glands which secrete wax. Hair is also confined only in the outer canal and therefore furunculosis is present only in the outer 1/3 of the canal. The bony part, it forms the inner 2/3 of the canal, that is 16 mm long. It is devoid of hair and ceruminous glands. About 6 mm lateral to tympanic membrane, it has a narrowing called as isthmus. The foreign bodies get lodged here and are very difficult to remove. It has a deficiency known as foramen of Hashke, permitting infection to and from the parotid. Now our next structure is the tympanic membrane. So tympanic membrane forms the partition between your middle ear and your EAC. It is obliquely set. What do you mean by being obliquely set? So look at this canal and this is our tympanic membrane. So can you see it is not straight, it is not perpendicular to the floor, is it? It is at an angle of 45 degree with the floor of EAC. So it is obliquely set. It is oval shaped. It's not totally circular, it's oval shaped. Now let's discuss the dimensions of our tympanic membrane. So let's draw a quick diagram to understand the dimensions. This is our tympanic membrane. It is 10 mm long. It is 10 mm long, 9 mm wide and 0.1 mm thick. Now let's learn about the color of our tympanic membrane. In normal conditions, it is pearly gray. But if it is red and congested, it suggests a condition known as ASOM or acute suppurative otitis media. If it is flamingo pink, like the bird from flamingo, yes, like that bird, flamingo pink, then it suggests otosclerosis. We'll learn about these diseases in further classes. So these are few important introductions regarding your tympanic membrane. Now let's learn the diagram of our tympanic membrane. Can you see these folds on our tympanic membrane? These folds are called as the malleolar folds. The one which is shorter is the anterior malleolar fold and the longer one is the posterior malleolar fold. This elevation that you see is called as the handle of malleus. This elevation is formed due to the attachment of malleus. The tip of handle of malleus is called as the umbo. Now, a tympanic membrane is divided into two parts. The part above the malleolar folds, is called as pars flaccida. And the part below the malleolar fold is called as the pars tensa. So in pars tensa, we have a fibrocartilaginous ring on its periphery. This ring is known as the annulus. What it is called as? The annulus. The tympanic membrane is also divided into 4 quadrants. Now, how these quadrants are divided into, let me show you. A line is drawn passing through the handle of malleus and another line is drawn perpendicular to the first line passing through the tip of handle of malleus, that is the umbo. Now this divides the tympanic membrane into 4 quadrants. Now this one is the shorter fold, right? So this is the anterior malleolar fold and this is the posterior malleolar fold. So this is antero-superior quadrant, this is antero-inferior quadrant, this is posterior-superior quadrant and this is posterior-inferior quadrant. Now when we are examining the ear with the help of an otoscope, a light will fall on this tip, the umbo, and it will reflect a shadow in the antero-inferior part. This shadow is called as the cone of light. Do remember this point, as the cone of light is always present in the antero-inferior part. Now further on, there are 5 different types of perforations in our tympanic membrane. It depends upon the location of our perforation. Now if the perforation is located in the pars flaccida, that perforation is known as attic perforation. If the perforation is located in the pars tensa and it is surrounded by tympanic membrane all around in 360 degree, all around it is surrounded by tympanic membrane, it will be known as central perforation. If the same perforation is located in the pars tensa and is not surrounded by the tympanic membrane in all its side, it will be known as the marginal perforation. If there is one large central perforation, one large central perforation, and only the annulus ring, this ring you see, only the annulus ring remains intact, it is known as the subtotal perforation. And if the annulus is absent and destroyed all around, then this is known as total perforation. Now, how to define the side of tympanic membrane? I'll draw two diagrams and look if the diagrams are correct or not. Okay. Then we will learn about how to determine the side of the tympanic membrane. Are both these diagrams correct? They are. Look at this diagram, the first one. This one is the smaller malleolar fold, isn't it? So it is the anterior side. So cone of light is present in the anterior inferior quadrant. It is the correct diagram. In this one, this is the shorter malleolar fold. This is the anterior side and the cone of light is present in the anterior inferior quadrant. So it is also correct. So now we will look at the position of our cone of light. Is the cone of light present between 3 to 6 o'clock or is it present between 6 to 9 o'clock? So if it is present between 3 to 6 o'clock, it is right ear. And if it is present in 6 to 9 o'clock, it is left ear. Now let's do a quick revision. Tympanic membrane forms the partition between the EAC and the middle ear. It is obliquely set. Its shape is oval. Its normal color is pearly gray. It is 10 mm tall, 9 mm wide and 0.1 mm thick. It is divided into 4 quadrants: antero-superior, antero-inferior, posterior-superior, posterior-inferior. It is divided into 2 parts, pars tensa and pars flaccida. Pars tensa, its periphery is thickened to form a fibrocartilaginous ring, which is known as annulus tympanicus. Its central part of the pars tensa is tented inwards at the level of the tip of malleus and is called umbo. A bright cone of light can be seen radiating from the tip of malleus to the periphery in the antero-inferior quadrant. The pars flaccida is located above the anterior and posterior malleolar folds. It is not so taut and may appear slightly pinkish. Now, layers of tympanic membrane. So, there are 3 layers of tympanic membrane. In the pars tensa, all these 3 layers are present. They are the outer epithelial layer, the middle fibrous layer, and the inner mucosal layer. Now in pars flaccida, only 2 of this layer will be present. So can you guess which layer will be missing? Correct. The middle male fibrous layer is missing in pars flaccida. In pars tensa, it has 3 types of fibers. The middle fibrous layer has 3 types of fibers: radial, circular and parabolic. Now let's move forward to the next topic. The next topic is the nerve supply of external ear. The pinna first we will learn about the Pinna's nerve supply. So the nerve supply of Pinna can be learnt by a mnemonic, that is lag 7 10. Lag 7 and 10. So L stands for lesser occipital nerve. A stands for auriculotemporal nerve. And G stands for greater auricular nerve. And 7 and 10 means 7th and 10th cranial nerve. Now, in the condition known as herpes zoster oticus, it is a complication of herpes zoster. Lesions are seen in the distributions of facial nerve, that is the concha, posterior part of the tympanic membrane, and the post-auricular region. The next is our external auditory canal. It is supplied by two nerves. Its anterior wall and roof is supplied by auriculotemporal nerve. Auriculotemporal nerve. And its posterior wall and floor is supplied by the auricular branch of vagus nerve. The last structure is our tympanic membrane. Its nerve supply can be divided in its two surfaces, that is the lateral surface and the medial surface. The lateral surface is further divided into the anterior portion. The anterior half of our lateral surface is supplied by auriculotemporal nerve. And the posterior surface of the posterior half of the lateral surface is supplied by the auricular branch of vagus nerve. Auricular branch of vagus nerve. The medial surface is supplied by the tympanic branch of glossopharyngeal nerve. So let's do a quick revision. The pinna is supplied by four nerves: lesser occipital nerve, auriculotemporal nerve, greater auricular nerve, and 7th and 10th cranial nerves. EAC is supplied by the auriculotemporal nerve, auricular branch of vagus nerve. The tympanic membrane is supplied by auriculotemporal nerve, auricular branch of vagus nerve, and the tympanic branch of glossopharyngeal nerve. That's it for the anatomy of external ear. We'll learn about the anatomy of middle ear in the next lecture. Thank you so much for your attention. Bye. Meet in the next lecture.